And we are back for the Invincible Health series with Dr. Vin, as always on Thursdays at 4:30. And this week we'll be discussing brain health again. But this week we're specializing our discussion around brain injuries because, as maybe some of you know, maybe some of you don't know, but today, March is Brain Injury Awareness Month. So we're going to get right into it with Dr. Vin. And I just wanted to know if you could give us the basics of brain injuries before we get into kind of the details of what we're going to talk about.
Sure. Brain injury occurs primarily when we're talking about brain injury. We're talking more about, when if you get hit in the head or, get struck with something, or in your car accident, you get whiplash. So there are primary effects where there's, compression of the brain tissue. And there are secondary effects where there can be, as the cells die, they release inflammatory cytokines and that kind of thing that can cause secondary cell death. So that's what happens, and obviously it disrupts the function of our brain when that happens.
And what are the most common ways that we would get a brain injury in those two different ways?
So, the most common ways, automobile accidents are certainly up there. Assaults or getting hit in the head accidentally, that kind of thing. But probably the primary way that most people sustain a brain injury, over 40% of people who get brain injuries, is from a fall. Okay. So a very preventable event.
Okay. Yeah. So and are most of the brain injuries related to falls very serious, or more concussion related, do you think?
For different people, it's different. The less protective mechanisms, if you will, somebody who's younger and has great reflexes, they fall, they may not hit their head at all, but somebody who has a very poor sense of balance, muscles might be weak, they fall and they can get a very severe head injury from striking their head. Or, sometimes when people get assaulted, you hear these things on New York City where people get punched from behind and they get knocked unconscious and they fall and hit their heads. And those people with no protective mechanisms get very severe head injuries sometimes and even die from them.
Right. And so for those instances too, if maybe someone, they know that they obviously hurt their head, but what are the symptoms that maybe it's worse than just, my head hurts, it's actually related to a brain injury?
So yeah, you mentioned the headache already, but things like dizziness, nausea, vomiting, or anybody who has any loss of consciousness or amnesia for the event, they definitely have a brain injury and should take that seriously and get evaluated.
Okay.
Because even what appears mild to some people can be, have long-lasting consequences, especially if symptoms are ignored.
So at that point, you're just either going to the ER or, into some sort of facility as soon as you can after that.
Sure. Yep.
Are there any differences we should be looking at between men and women or children? I know some, with heart attacks, there's different symptoms related to, men and women, but I don't know if that's the same with a brain injury.
Yeah, I don't think that the symptoms are really too different. I think children, their skulls are a little bit more malleable, so they don't require as much force to have a brain injury. I guess the good news is that they're still growing, so, they seem to recover better than adults do. But, I think the symptoms are the same. You're watching for, was there any loss of consciousness? Is there any vomiting, that kind of thing. So sometimes, especially the younger children, they really can't tell you what's going on. So you just have to look for those more objective signs like vomiting.
Okay. And as far as longer lasting impacts of brain injuries, what are we seeing, people having to deal with more chronically after that, if there's not a way to fully heal it?
So people deal with everything from, they might have lost some ability to do some things that they did before, sometimes more complex things, more complex thinking. Some people become more irritable, emotional. They can't control their emotions as well. And sometimes these can persist for long afterwards. Some people with concussions can have these prolonged concussions where if they try to focus or concentrate for too long, they get a headache and they can't do it. They start becoming nauseated. So, the more severe the injury, the obvious more and more symptoms that people have. And some injuries, unfortunately, can be devastating.
Yeah.
Can lead to disabilities and real loss of function of even people becoming paralyzed, especially if there's bleeding in the brain or anything like that.
Yeah.
And some people it takes a long time to recover. Some people never recover fully, but there's actually I think she was a psychologist who had wasn't exactly a brain injury, more of an internal brain injury, if you will. She had a cerebral hemorrhage. It took her 8 years to regain at least most of her function, and 8 years of kind of concentrated therapy to do that. So, I mean,
Yeah.
we're never sure how much people can recover, and sometimes it takes a lot longer than we anticipate. But people can recover, and especially if they work on it and they're persistent.
Yeah, that was the follow-up question I was going to ask. What are the treatments that we're seeing as far as all the different types of brain injuries that people can have? I'm hoping that with technology and time, we have better treatments to help people, maybe heal sooner or quicker than they used to.
Yeah, I mean, so certainly therapies, sometimes it's physical therapy if they've lost any motor function anywhere, help them regain that. But yeah, some of it is retraining the brain essentially for functions that are lost. And there's more and more evidence that you can do that kind of stuff. We haven't, I don't think we've pushed the envelope to see exactly what's possible.
Yeah.
But the brain is a lot more plastic than we thought it used to be. I mean, it used to be thought that, yeah, once that a neuron is dead, then nothing will regrow. And I think now there's, whether neurons regrow or another area takes that over, sometimes you can regain some function that in the past it wasn't possible to do that.
Okay. So there's research being done, hopefully right now, that they're learning more about the brain and learning different ways to heal after brain injuries. So we at least have hope for the future, and those with brain injuries maybe can heal more than they had previously been predicted to.
Yes, yeah. As I said, unfortunately, some people are left with long-lasting deficits. Mention a special population here, veterans who have come back from the wars, who, have been in explosions, IEDs or whatever, and, they sustained brain injuries. It's hard to recover. It's hard work. So we always want to keep that in mind. And, we want to make sure that we're always very respectful of these people. Sometimes I think people get, I think some of the brain injury survivors feel like they've been slotted into a box, that this is a damaged individual, and people don't treat them quite the same way. So I think we need to, be very mindful of that and help them out as much as we can. I'm not just talking about veterans here, but anybody with a brain injury, whether it's, they've been in a war or it's been on the streets of New York City or it's been from a fall. It certainly can change people's lives, and we just have to be patient with them and understanding with them, and really, try to bring them along, because I think compassion and empathy goes a long way, and treating them as an individual and a person goes a long way for these people.
Yeah, and it being Brain Injury Awareness Month, I think, part of that, it's not just to learn more about the science behind brain injuries and, how people heal from it, but it also is to remove stigmas around those, with any disability, those unfortunately do exist. But to your point that you were just speaking about, it's so important to be compassionate, to provide resources, to provide funding toward, learning more about how to heal brain injuries and things like that. So that's really, I think, an important piece of the conversation around brain injury and Brain Injury Awareness Month. So thank you for saying all that. Is there anything else you wanted to mention as far as brain injuries relate to maybe the brain or cognitive stuff that Princeton Integrative Health is going to be doing in the next few weeks?
Yeah, so as some of you may know, we're launching our brain health program, preventing, stabilizing, and reversing cognitive decline. Brain injuries can be one of the contributors to cognitive decline, to dementia. So that's always an important component that we're looking for. And that's again why it's so important that people get treated at the time that they're injured, that to hopefully decrease that risk of dementia, long-term consequences from that. So mild brain injuries, not so much such a risk factor, but certainly some more severe brain injuries can be a risk factor for dementia. So something else to keep in mind for people. And yeah, again, I guess in that same vein of getting treated, making sure that they have the resources, and if it's anything related to auto accidents or assaults or whatever, to get good legal representation, even to make sure that they get the resources that they're entitled to.
Right. And even, for their caretakers, because obviously if they're going to have to be in a situation where someone's helping them to gain access to resources, gain access to the right legal team, there has to be more awareness around that for everyone, not only the patient, but their family members as well. Great point.
And I guess I'll mention the Brain Injury Association, because they seem to be at the forefront of, certainly one of the groups at the forefront of raising awareness about this, of bringing resources together, of helping people find even legal representation in the area to help them. So I think that could be for people a great resource, and you can check all that out.
Yeah, and it's an issue that affects all different types of people, children, like you mentioned, a lot of military, but it's not really focused on one particular group of people. It really could affect anyone. So it's important that we do give it the awareness that it deserves, and hopefully, bring more funding and awareness to it.
Yeah, and I guess another special group I do want to mention is the elderly, because again, it's
Right.
faults that are one of the biggest risk factors for brain injury. And as we age, our muscle tone goes down, our balance goes down, and that's a big risk factor. So it is important as we age to make sure that we're doing strength exercises and balancing exercises to really try to prevent that from happening. And that could go a long way to preventing brain injury also.
Absolutely. Well, I don't see any questions. Please feel free to reach out to us if you have any questions about brain injuries, brain health in general. Please give us a call at 609-512-1468, or you can email us at info@princetonih.com, and we'll be back again next week. We'll still be talking about brain health, and I think we'll be doing something around dementia to follow up on this conversation. And but yeah, please, if you have any questions, reach out to us, and we'll be back and give you more information about the brain. Thanks, Dr. Vinny.
Thank you, Krista.
All right, have a great day. Bye.
You too. Bye-bye.